Good morning and welcome everyone to this week's episode of Tooth Teacher Tuesday. As always, I am your humble host, Dr. Steven Zom, and today we've got another episode of Oral Pathology Corner. Today, kind of gave a little hint at today's topic last week, talking about how health conditions and medications can affect what we do in dentistry, and one of those of particular importance is what we're going to talk about today, and it's a mouthful. It's a condition known as medication-related osteonecrosis of the jaw. Yeah. Typically we'll abbreviate that just to the initials and shorten it to MRONJ. But what that long extended name means, what it is there are certain medications out there, and we all know medications come with a list of side effects that are a mile long, but there are particular medications that are taken for a number of reasons that affect bone health, specifically trying to basically make the bone healthier, in the sense that for someone who has osteoporosis, or then also just sometimes when we're trying to balance someone's estrogen levels, whether it's from a hormonal imbalance or due to breast cancer, or any other number of reasons. These medications, one of the unintended side effects is that it inhibits the bone from breaking itself down. And what I mean by that is we have cells in our bones that create bone, we have cells in our bone that destroy bone. And destroying bone is normally a good thing. It helps to kind of recycle things, so to speak. And so part of a normal healthy balance is that bone is broken down and rebuilt, broken down, rebuilt. But for someone, for example, who has osteoporosis, the bone is breaking down quicker than it's building back up. And that's why these medications inhibit that part of the cycle so that things are only building up. Which sounds great until we have someone that we're trying to extract a tooth or place a dental implant or anything where the bone needs to heal. Because if the bone is trying to heal and we have a medication that's preventing proper breakdown to then recycle and create new bone, it's not going to typically heal properly. And that's what induces this MRONJ. And so in the event this happens, it's fairly serious. It's not impossible to treat, but it can be quite difficult. But it's going to look something about like this, and for anyone who's a little bit squeamish, fair warning, it can be a little bit graphic looking, so you might want to look away. And you can join me again here if you looked away. And that's just one possible presentation of what MRONJ is going to look like. But it's very serious, because if the bone's not healing properly, then it starts to become, as the name suggests, it starts to become necrotic. The bone starts just dying altogether. And if left untreated, that can cause basically the jawbone to just eat away at itself until there's nothing left, which is obviously very problematic and something that can be avoided with proper precaution. And so, like most things in healthcare, prevention is the best medicine. And this is why your dentist takes a thorough medical history to screen for things like that, so that in the event that you needed any kind of surgical dental treatment, we can consult with the prescribing doctor for these medications to see what we should do. And typically what is going to be recommended is that we take a drug holiday, is what we call it, where you stop taking that medication for X amount of time to allow your body to clear it from the system, so that there's no concern that it would inhibit proper bone healing. Um, Obviously, and that's not ideal, taking you off of medication, because it is benefiting you elsewhere in the body, but we also don't want it to create a new issue in the mouth. So, and then in the event that someone were to develop MRONJ, treatment, like I said, is difficult. It usually involves pretty extensive surgery to remove the diseased and dying bone out of there, and then trying to graft and reconstruct things. Part of it just depends on how advanced it is at the time that it's diagnosed. But again, certainly the goal is to prevent it from ever happening in the first place. So just another reason why, we're not, as dentists, being nosy when we ask about your full medical history. It's just these kind of things that we need to know to keep your best interest in mind. So please don't be withholding anytime you fill out a medical history. Give us the full picture so we can give you the full extent of care. So hope that makes sense. Hope you found this topic interesting, and until next week, I want to thank you for joining me, and I hope you'll join me again next week.